You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode I spoke with Dr. Bruce Whittle about all things equine dentistry, from the basic oral examination to common abnormalities and strategies for addressing them. This episode of Disease Du Jour is brought to you by Bimeda. Dr. Bruce Whittle graduated from the University of Missouri in 1994. He and his wife, Dr. Gayla Whittle, moved to Trenton, Missouri, purchased 2 acres of ground, and established Honey Creek Veterinary Hospital 2 weeks post-graduation. He has always considered himself a mixed large animal practitioner. He has a passion for horses and developed an interest in equine dentistry that keeps growing to this day. He began as a volunteer instructor for student AAP dentistry workshops in 2009 and has since taught 48 courses at 24 different veterinary schools. He also established an equine dentistry seminar in wet lab through the Missouri Veterinary Medical Association, of which he is an active member and past president. Dr. Whittle has been active in scope of practice issues for both the MVMA and AAP. At the insistence of his wife, he also developed an interest in small animal dentistry and helps teach students small animal dentistry surgery labs at the University of Missouri. In his free time, he loves teaching equine dentistry, but also enjoys backpacking, fly fishing, kayaking, and woodworking. Thank you, Dr. Whittle, for joining us today.
Thank you for the invitation. I'm excited about it.
Yeah, I'm really excited to talk to you about dentistry. Can you get started by sharing a little bit about your background and what inspired your passion for equine dentistry?
Yes, I'm actually a mixed animal practitioner. My wife and I started our practice right out of school. She's a veterinarian also. We were classmates, and so we just decided to jump into the deep end, and she always did the small animals and I did the large animals, and I got interested in horse dentistry, and then I ended up sedating horses for lay floaters, and then when I realized I was liable for everything they did, I decided that I needed to do a better job, and I just keep trying to do a better job every day, and I just keep getting more and more interested. And in 2009, I started teaching dentistry weekend workshops at different vet schools through the AAP on a volunteer basis. And I think I just taught my 48th one this past weekend. And so I got to work with a lot of experienced veterinarians and learned a lot that way. And so now I'm trying to incorporate some younger veterinarians to help them along and give them some mentorship. And so, yeah, that's kind of my story. And so I do a little bit of everything, but horses and horse teeth especially are my passion.
Well, it's such an important topic, and it makes such an impact on horses' health. So I'm really glad that we have this opportunity to hopefully provide a little bit more education. Can you get us started by explaining some of the key components of a thorough oral examination?
Yes. When I teach students, we go through about a 10-step process, and I think that that's really important for anything in veterinary medicine. If you're not consistent, you're going to miss things. And I think in medicine in general, we're kind of getting away from the importance of the exam, and we try to skip on to more advanced things too early. But so just like in any other discipline in veterinary medicine, or medicine in general for that matter, history is very important. I hate going in blind, and the more information you have, the better. And what kind of problems is a horse having, because a lot of times the owner's not just going to bring the horse to us for dentistry. There's some problem that they're having, and they may think it's their mouth. But so anyway, the history can be very important. What type of bitting do they have? What type of diet? How much time do they spend in a stall versus how much time do they spend grazing? So history, kind of the beginning, and then a good general physical exam. And, we need to sedate the horse. And so we need to make sure that the horse is healthy enough that we can sedate them. And, for example, I haven't had very many horses that I've not gone ahead and done some kind of dental procedure that day, but I have had horses that have a fever, and it can be dangerous to sedate a horse that has a fever because they can have an idiosyncratic reaction to some of the drugs, besides the fact that they may be contagious and we may be contaminating our equipment. And then if we're doing other horses and not careful, that could be a problem. Plus, there are other things like Cushing's disease, for example. That's not going to say we're not going to do the horse that day, but it's something that we need to address. And so, the horse is probably, if we're going to do an extraction, the horse may not heal up as well if they have Cushing's disease. So maybe we would put it off and, address the Cushing's disease first, or I've had horses that had no gut sounds. And I'm like, well, maybe we better treat the horse for an impaction colic before we sedate them and slow their gut. So things like that. And then, we're also looking at the head. So that's kind of our initial exam of the head. And I think it's really important to be in a dim environment. I see lots of videos, and I'm not bashing the veterinarians in Australia, but I don't think veterinarians in Australia work inside, and that would drive me crazy because I like to be at least under a roof, because if I have much glare around me, I just can't see as well into the horse's mouth. So doing it under the shade tree in the backyard is not really ideal. Sometimes that's what we've got. Then I'll sedate the horse, and I think the important part about sedation is not rushing it, because sometimes, we're busy and we get in a hurry. And if we rush the sedation too much, then it doesn't work as well. So I write a time on my dental chart, and I'll look at the time and I make sure it's 5 minutes. And so I'll start working on the paperwork and, get some other things ready. And sometimes I'll go back and I'll look at my clock and it'll say, I'll think it's been 7 minutes and it's been like 3 minutes. So if I don't write it down, I'm messed up. And then I'm going to do my incisor exam. I want to make sure, especially in a young horse that's shedding baby teeth, that they don't have any sore teeth, because they're going to get mad when you stick a speculum in their mouth if you're putting pressure on a sore tooth. And same with an older horse that has like EOTRH. Those horses, I know I was guilty of this. I'm sure other veterinarians have been as well, of those older horses. And you think, well, this horse is just dumb. And you just keep sedating him, and the horse is trying to tell you that their mouth hurts, and, we're not picking up on that. So then I'm going to do a functional incisor exam. I'm going to look at excursion to molar contact, and I'm going to look at their rostrocaudal mobility of their mandible. That kind of gives me an idea of how they're able to chew and if maybe they have some abnormalities that are affecting that. And then I'm going to put a speculum in their mouth. Everybody has a different opinion on what speculum. You just need something that's safe. And then a very bright light. I prefer a headlight. Some people like a speculum mounted light, which I usually use as well because I'm usually teaching. And then I'm going to palpate the teeth, and then I'll use either a mirror or I use an oral scope now. And that revolutionized my dentistry. And then, based on that, we should probe and explore every tooth like they would in human dentistry or like we do in small animal dentistry. But horses are good about breaking instruments with their strong tongues. So I kind of go based on what I'm seeing with my other parts of the exam. And then I record everything in a dental chart. And then at that point, then I would be ready to do some kind of treatment. So I think instead of treating it as, the horse is presented to us for floating, it's really presented to us for an oral exam. We figure out what's going on, we get a diagnosis, and then we treat based on that, not just a cookbook approach.
Right. Yeah, that last comment made me think, do you float every horse that's presented to you for floating, or does sometimes oral exam make you believe that the horse doesn't necessarily need that?
I'd like to say that I don't float every horse, but honestly, I'm usually finding something. But I'm not working on a horse every 6 months usually either. So,
right.
Most of the time, it's hard to get my clients to do it, as often as we would like to anyway. But my clients accuse me of being able to find something wrong in the mouth no matter what. So, but I don't know I think that's a good thing, but yeah.
Yeah. Today's episode of the Disease Du Jour podcast is brought to you by Bimeda Equine. Bimeda might be the biggest animal health company you've never heard of until now. Bimeda's products have been trusted by veterinarians and owners since the 1960s, when their Irish roots began. Bimeda is one of the largest producers of dewormers like Equimax, Bimectin, and Exodus. World-renowned equine athletes also rely on polyglycan, a patented formula that replaces lost or damaged synovial fluid, and Confidence EQ pheromone gel, which reduces and prevents equine stress. Consult your vet and visit bimedaus.com to see where to buy. So what are some common signs of dental issues that you're watching for when you're doing these exams, or even when you're talking to the owner and getting a background on the horse?
Well, I think the owners, a lot of times it's going to be either they're dropping feed or they're they've either lost weight or they're not gaining weight back like they should, or they have bit issues, or they're starting to exhibit some kind of weird behavior that they think may be attributable to the head. That's probably why most of the horses are going to be presented to us. And a lot of times by the time they have signs, they may have more severe pathology, because even us as veterinarians aren't very good at picking up on some of those things, and especially since we don't know that individual horse as well as the owner does. And I remember a case a long time ago that a client who was a barrel racer, and I'm not going to comment on that, but she thought her horse was running too slow and wanted me to look at the teeth. And we had done the teeth about 6 months prior, and I said, I don't think it's a dental problem. And she was just convinced it had to be. And so she brought the horse over. I did an exam. I palpated. I looked at everything, and I couldn't find anything wrong. And she said, can you just lightly float him? And I said, there's nothing to do. I can't find anything. She said, will you please just do that? I said, sure, that's fine. I said, we're wasting my time and your money, but if that makes you happy, then that's okay. So we did that, and she calls me probably 10 days later. She'd had a barrel race the next weekend. She said, yep, he's way better now. So I don't know. I never could find what was going on. But then you see other horses that are just, they're butterball fat and their teeth are horrible. And you think, gosh, I don't really want to make them more efficient at being able to chew or whatever. But yeah, so it varies a lot. But that's kind of the owner side. And I think, if I have a horse brought to me in a trailer, I like to look in the trailer, because a lot of times they've defecated, and especially in the middle-aged to older horses, if I'm seeing longer fiber in the manure, then I know that they're not able to chew quite as well. So then that's what I would be looking for. I think we need to quit scheduling like an annual float, and we need to schedule it as like an annual oral exam maybe, which is hard to sell. But I think that if we are finding problems early, then we're going to keep that horse in a lot better shape by doing that.
Yeah, that's a really good way to frame it. What are some dental abnormalities that you encounter frequently? And maybe you can break it down into young, middle-aged, and older horses.
Okay, good question. Young horses, we tend to see more the eruption type problems, or teeth aren't shedding properly. They may have maleruptions where a tooth may come in twisted or something like that. Or we're looking at horses that are going to start training pretty soon. And, one of the things that's very controversial is wolf teeth. And there are two populations of veterinarians that work on teeth. It seems like either you think that every wolf tooth's bad and needs to come out, or you think that the wolf teeth were there for a reason and you shouldn't mess with them because they shouldn't cause bit problems. If I have a young horse, I'm probably going to err on the side of extracting the wolf teeth, unless they're smooth or placed where I don't think they're going to cause a problem. If I think there's a possibility, I don't want the horse to go to a trainer, and then, the trainer's having issues. They send the horse back, says horse having problems, or why didn't the vet extract those wolf teeth? And so, but if it's going to be a brood mare, I'm not going to worry about the wolf teeth, because she's never going to have a bit in her mouth. But those would be the young horse things. So usually that's up to about 5 years of age. In their first 5 years of life, they're going to erupt 24 baby teeth. They're going to lose those over time, and they're going to erupt up to 44 permanent teeth. So 68 teeth are coming and going in their mouth in the first 5 years of life. So there's a lot going on. So I usually recommend examining those twice a year, just so we can catch problems early. Middle-aged horses, we're probably thinking about earlier malocclusions. They've got some ramps forming or some hooks, and we don't want those to get too big, because that's going to cause longer-term problems. The sharp enamel points, which is controversial. Some people are saying now that enamel points are normal, and that's not really a problem. But when I see gouges in the cheek and they have sharp points, then I'm certainly going to address them. And then also another thing we'll see are what are called infundibular cavities, where the infundibulum, which are in the upper cheek teeth, they have they're actually invaginations of enamel. But when we look at the surface of a tooth, we're seeing what was actually inside the tooth at one time. And then with wear, it's exposed. And sometimes, well, these infundibula should have cementum, which is on the outside of the tooth. They should be filled with cementum, so there aren't voids in the surface of the tooth. But sometimes there will be voids because it didn't form properly, or you get maybe some type of acidic process that dissolves the cementum basically. And so then, there's a lot of controversy on that too. Some people will fill those. I'm not sure from an anatomic standpoint how effective that is, because when we think about like a root canal in a person, the dentist is really working with dentin inside the tooth, and that's it. And so they just have to bond something to dentin. But in a horse tooth like that, with a lot of infundibular cavities, we're dealing with dentin, cementum, and enamel. And so most glues don't glue well to more than one thing, or, a variety of things. So a lot of times what I will do is I might take a couple teeth out of occlusion just so that, the opposing tooth isn't gonna, destroy that tooth as fast. And then older horses, we're looking at more severe abnormalities, more severe malocclusions, like the wave mouth that a lot of people have heard about, periodontal disease, which can occur in any age of horse. And periodontal disease, interestingly, in most other species, it's hard to find a good study in horses where there's a good number, but in other species, they consider about 70% of individuals have periodontal disease at any one time. So it's bar none the most common disease in most species. And that causes the teeth to become loose and less functional. And then the EOTRH, equine odontoclastic tooth resorption hypercementosis, which has to be the coolest disease name, not necessarily the coolest disease in veterinary medicine. But those horses, they get the teeth basically dissolve from the inside in a lot of cases. Sometimes they have mostly hypercementosis, and those aren't as painful, but resorption is very painful. We know that from a similar disease in people as well as in cats. And so that's something we'll see. Usually you see it in maybe 15 and up, something like that. They've diagnosed it in much younger horses, but mostly it's older. And then a lot of times in these older horses, they've lost some teeth, or they have teeth that aren't occluding as well. And then we're really thinking about nutritional counseling, and maybe that horse can't survive solely on pasture or on hay, and so they need some type of a processed pellet or something that they don't have to process quite as much.
Do you have any tips for distinguishing between normal aging changes in the mouth and pathological abnormalities that might need to be addressed more seriously?
I think that it's almost like there's a continuum, I guess, but normal aging changes as the teeth wear, as they wear closer to the root, they're going to get narrower. And a normal process in the horse is to drift the teeth together. The front two cheek teeth the front two cheek tooth, I guess, and the back two cheek teeth are sloped backwards and forwards respectively, so that they try to pack the teeth, because in a horse, the 6 teeth in each cheek tooth arcade basically work as one functional chewing surface. And so when we have gaps between those, that's where periodontal disease occurs. And, we get enough bone loss around a tooth, then that tooth is going to get loose, and then that horse isn't going to chew as well. They're going to lose weight and then have problems. So, diastema, that can be kind of a normal aging change, but it's going to, cause problems at some point. And eventually you see this, especially with the front lower cheek teeth, what we call the 306 and 406, and those teeth will wear, and those teeth have 2 roots, and then you'll see just 2. It's like there are 2 individual teeth sitting there, but it's just because the teeth have worn so much. They've worn all the way into the root. So that's kind of a natural process, because horse teeth are designed to last for about 30 years or so. And it kind of an aside, there was an interesting study out of Finland where they made what they called a mechanical masticator, and they could grind teeth against each other kind of in as close to a normal manner as possible. And they put different feed materials between them. And a lot of people think that most tooth wear occurs from tooth on tooth grinding. And when they did this study, I can't remember the number, but I want to say that they estimated with tooth on tooth wear, the teeth would last for about 275 years,
Oh my gosh.
which is crazy. And then, but if they had Lucerne, which I think is like alfalfa, they lasted for about 30 years, which is what we'd expect. So, which I thought that was very interesting. And it's actually in the paleontology literature. So, most people don't really run across it. But what I thought was interesting is that tells me that it's the feed material that's wearing the teeth. And that's why when we see, say, a horse with a wave mouth, that top and bottom are not exact mirror images of each other. So that kind of complicates things. But the pathology, then you're looking at like periodontal disease. And again, part of that's because you get the teeth are narrower towards the roots, and you get the diastema, the abnormal spaces forming. And then also abnormalities in the height of the teeth because of the way they wear. Those infundibula, they are typically about 80% the length of the tooth, so eventually they're going to wear out. And once the infundibula wears out on an upper cheek tooth, then that tooth can't wear equally to the lower tooth that it occludes with, so that lower tooth will get taller because it's basically, stronger is not really the right word, but I don't know how else to phrase it, but that one will get taller, and then as the other one gets worn more.
Right, that makes sense. So I'd love to jump in now to talking about how you address some of these abnormalities, maybe starting with fractured teeth. What's your approach when you encounter this in a horse, and when do you typically recommend extraction?
Okay, good question. So fractured teeth that can happen in many different ways. A study, probably around 2008, maybe a little bit before that, they looked at fractures of cheek teeth, and they found, contrary to what most people thought, that the most fractures are actually through a pulp horn. And, a lot of people think of the upper cheek teeth as fracturing through those infundibula and splitting in half. And I certainly see quite a few of those, but I don't remember I want to say around 2012, it could have been a little bit before that, people were starting to use oral endoscopes in the mouth, and you see things much more magnified, and you see a lot more. And they were seeing what they called dentinal fractures, and they could be either perpendicular to a pulp, or they could be kind of almost parallel to them, but they would kind of curve across the surface of the tooth. And you'll see a lot of minor fractures where just part of the tooth fractures off. And I don't think we know what to do with those now. The nice thing about the horse is when they have a fracture, a lot of times they're odontoblasts, which are present throughout the life of the tooth, unless we kill it kill the tooth for some reason by like grinding too much on it or something like that. Those odontoblasts produce several different kinds of dentin, which comprises most of the internal substance of a tooth over time, and the pulp gets smaller over time. But those odontoblasts can produce what's called tertiary dentin, which is kind of like bandage dentin, and they can lay it down really, really fast, and they can wall it off. And so sometimes you'll have a fracture that might even expose the pulp, and sometimes horses can wall those off, and the tooth does not get infected. I mean, horses are healers. Anybody that's dealt with wounds on a horse, we complain about proud flesh and everything, but that's because the horse, they want to heal, and they try to heal really fast. Well, they don't always win the war with their teeth. And so sometimes you have what we call those sagittally fractured teeth in the upper cheek teeth, where they fracture front to back. So you have two sides, so it's just split down the middle lengthwise. On some of those, you'll have one fragment will be loose and the other will not. You remove the loose fragment, and you can take an x-ray, and sometimes there's no change at the root. And so you might leave that tooth in place, that part of a tooth. You definitely would want to monitor it with x-rays maybe every 6 months or so to make sure it's not causing a problem. But it seems weird to leave that tooth, but if you extract that tooth, the teeth are trying to drift together. And then, because anytime you extract a tooth, I always counsel my clients that we're probably going to have to float the teeth more often because there's going to be an area that's not going to wear appropriately, and we're going to have to do the wear for the horse. But so it's a good idea to radiograph those things, and sometimes you see one that goes through a pulp horn and they might wall that off, but you definitely, if the tooth is not loose and you're not seeing disease at the apex, I think the trend now is probably to monitor them more than just automatically extract them like was done in the past. Veterinary medicine kind of goes through phases.
Yeah, that's a great point. It's nice when you can do sort of the limited intervention as much as possible and not have to mess around with it too much. How do you approach other complicated cases, maybe involving periodontal disease or some other serious abnormalities? And at what point do you like to refer a horse to a hospital setting?
Okay, so I think the basis of dentistry is a thorough examination. And I think that should be using a mirror or an oral endoscope. I mean, it took me a long time to go to the oral endoscope just because of the expense, but I put mine together, and I think I put it together for about $2,000. So, an X-ray machine costs way more than that. Yeah. So, and it truly revolutionized my dental practice. I mean, I think it made it more fun. And I joke with my clients, I haven't decided if it's a toy or a tool yet, but I'm convinced it has to be a tool, but it is a lot of fun. And, the clients, they can see, I use an iPad as my screen. And so even when I'm teaching vet students, I used to, when I would use a mirror, it's hard for me to see what I'm looking at in the mirror. And maybe one student could see it, but, 10 other students, they couldn't see what we're looking at. But with the scope, you can get 20 people that all can, crowd around and see that screen. So it makes it a lot easier. And then, doing the periodontal probing and, using the Explorer and, I think just doing a good exam and then, really evaluating what you're looking at and then coming up with whatever the treatment approach is. In equine veterinary medicine, some things are easier and some things are harder. So like periodontal disease, because horses have hypsodont teeth where they're continually erupting throughout the life, so the periodontal ligament is continually remodeling. Periodontal disease can be improved. If we get bone loss, we can't make new bone. We would have to put the bone in there like we do in small animals. But in a horse, a lot of times periodontal disease is due to malocclusion. So you might have a tall place that is kind of sharp that is wedging two opposing teeth apart. And if we take care of that area, then we don't have those pressures that are trying to push those teeth apart. So I think sometimes it can be pretty simple. Once the periodontal disease gets so bad, and it's even with x-rays, it's really hard sometimes to evaluate how much bone loss we have because the teeth are so close together and there's so much overlap of structures. But the classic in humans and small animals, if you have 50% bone loss, you automatically extract the tooth. Well, sometimes it's hard to evaluate that in the horse, but usually if the tooth is loose enough, if you can move it a few millimeters in any direction, or especially if you can kind of push it into the socket more, then that tooth needs to go. But if they're just very lightly mobile, sometimes you can take a little bit off that tooth on the occlusal surface and a little bit on the opposing tooth, take them out of occlusion for a few months, and you come back and look at that loose tooth and it'll have firmed back up again because the periodontal ligament has had a chance to heal. That doesn't always happen, but sometimes that can happen. As far as, when to send to a hospital, I mean, it's amazing what people can do in a standing horse anymore. I mean, the farm's not always the best place to do things. It depends. I'll take out, say geriatric teeth. Sometimes those can get more involved than what you want because the roots are long and it's very frequent to break those off and then you have to go retrieve the roots. But really, unless it would be something where the crown's fractured off to where you can't grasp it and take the tooth out from inside the mouth, then that would be the time where I would refer to, take it out through the side of the face maybe. So that's probably a hospital thing, even though those are done in a standing procedure most of the time. Having enough equipment, most of us don't carry all of our equipment around in the truck all the time. So,
right. Are there any procedures beyond the oral exam and routine floating that you believe vets should be comfortable performing? And do you have any advice for veterinarians looking to improve their dental skills or incorporate more advanced tools into their oral exams?
Yeah, I think that, when you're starting doing dentistry, I think you should focus on doing a very good, thorough oral exam. And the more you look, the more you're going to see. And I've told students since I started teaching that if you're not using a mirror, you're not doing dentistry. So mirror/scope. I think that diastema burring or debridement is something that anybody can do. It's scary. I mean, I still don't like doing it because I'm still always worried I'm going to harm a tooth, but sometimes we can help those teeth or those horses that have gaps between the teeth and make it so feed material's not sticking in there and fermenting and rotting. Extracting the teeth on the older horses, you'll have a horse that comes through the winter is kind of the classic that, they've lost a lot of weight. And so, the owner brings them to you and so, yeah, he was kind of thin in the fall, but I thought he'd be okay. And then they're just really skinny. And you go in there and you find one or two loose teeth and you extract them. The horse does a lot better, which it helps when the grass is coming on at the same time. It makes you look good because the horse starts gaining weight. But so we need all those advantages we can get. But no, I think geriatric teeth are very doable for a lot of people. I think that you just have to have some basic equipment. And so you don't have to have a lot of different forceps to do geriatric teeth, but I think you do have to have some way of getting the roots out if you have a problem. So there are a number of T-handle sets with interchangeable tips on them that can be helpful. And then radiographs are very helpful. I mean, I do small animal dentistry as well because my wife doesn't like it. So, which has made me better at horse dentistry. But in small animal practice, we wouldn't think about extracting a tooth before taking a radiograph. But it's very common in equine dentistry to, maybe never take a radiograph. Sometimes, a lot of times take one afterwards, but there's a lot of information you can get beforehand and say, that one's not going to be as easy as I thought it was going to be. So we should be shooting more radiographs on those kind of cases. As far as for what veterinarians should do to improve their dentistry skills, I think, and I also teach a course for veterinarians every few years. And I think that a lot of times people will contact me and they'll want to do the course that I help with. And they'll say, oh, well, that's too basic. I want to do advanced dentistry. And a lot of times I've been able to talk them into doing it. And at the end of it, they're like, oh my gosh, I needed the basic stuff. I didn't know what I thought I knew.
Yeah.
So, finding a course that is more based on the basics. I think the anatomy is super important. And a lot of people don't understand the anatomy well enough. I think a lot of us must have slept through anatomy in vet school, but, we didn't think it was as important at the time, but, now it's super important. But I think that's the big thing. And then I think the other thing, I've had younger veterinarians call me and for advice, and they'll have a case where, like, I had a veterinarian that she calls me and she said, I broke an incisor off trying to extract it. What do I need to do? I said, take a radiograph. So she does. She sends me the radiograph. She said, what do you think? I said, well, that root has to come out. She said, oh, I don't think I can do it. Can I send the horse to you? Well, I ended up having to go to her, which was further than I'd normally go, but it worked out time-wise. And so I said, well, you need to be there when I do it so you can kind of get an idea. And so, I was just trying to help teach her at the same time. And I think most people that do dentistry are more than willing to help other people. And so I think that can really help. And I think the biggest thing is just looking in horses' mouths and doing a good exam, getting that mirror out or, making the investment in the oral scope. And you'll see so much that you don't even know what to do with. That's the frustrating thing. But I think the more we look and the more we think about it, engages our curiosity, and we just want to do a better and better job all the time. So.
Right. Well, that's such great advice, and I think this whole discussion has been really informative and educational. Do you have anything else that you'd like to add before we wrap up today?
The main thing is just that the teeth are the coolest part of the animal. And I don't know why everybody doesn't want to do dentistry, but it's just, it can be a lot of fun, just like anything else. I mean, I have friends that, they would prefer to spend their time at the rear end of a mare, and I'll leave that to them. And I'd much prefer the front end of the horse. But no, I think that I think the key to preventing burnout in veterinary medicine or any profession is finding something you're passionate about. And I'm so fortunate that I found dentistry, because my wife has told friends of ours that if I hadn't found dentistry, I would hate being a veterinarian by now. And, I've just found that passion in it. And I feel sorry for people that never find the passion in whatever profession they're in. But yeah, it's just, but I think dentistry, it's very important for the health of the horse. Every horse really needs dentistry. And, it's something that we as a profession are probably not providing to the degree that we should. And so there's a huge growth opportunity there. So young veterinarians that, develop an interest in it, I think they can kind of write their own ticket, so it can be a very, very good part of veterinary practice for sure.
Yeah, that's such great advice, and we really appreciate you coming on and sharing your passion with us on this episode. It's such an important topic and really brought a lot of great information to it. So thank you.
Thank you for the opportunity. I'm always happy to talk about teeth.
Great. Well, we're happy to hear about it anytime. I want to say thank you again to Dr. Whittle for joining us, and thank you to Bimeda for supporting this episode of Disease Du Jour. And as always, thank you to our audience for listening. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.